Hello, I am Haley. This is Fredward. And I did my health report on the current crisis of coronavirus, COVID 19. I got my article from NPR. It is titled Who's Hit Hardest by COVID 19? Why Obesity, Stress, and Race All Matter. And this article kind of goes into mainly how obesity is affecting the symptoms of people with coronavirus. Their symptoms are much worse. Obesity in itself causes the immune system to be less effective. And it even goes over how regular flu vaccines are less effective for obese patients. They are more severely impacted by respiratory viruses as well. And so we also know from our health disparities class that obesity is very prevalent in low-income and minority populations. So then this goes into to give us some statistics of the people who are hospitalized from this. It says that 89% of hospitalized patients had at least one other chronic condition. Half had high blood pressure, a third had diabetes, and a third had cardiovascular disease. And so with these pre-existing conditions, those who catch the virus are more severely affected. And we've all heard that on the news. And so then when we get into how race is playing into this as well, it's saying that 33% of the patients who are hospitalized from COVID-19 are Black, but only 13% of our U.S. population is Black. And then in addition to that, 34% of the coronavirus deaths are of Black people. So we can see that there's just something not adding up there. It's not a proportionate stats on there. And we already know that Black people have worse health outcomes than majority of the population. And there's a lot of reasons for that, which we've talked about. But with this crisis going on, it's kind of bringing that more into light, into the media, I think. When I first heard them talking about it on the news about how African American people are suffering much more from this, I was kind of like, well, they always do. Like, that's not new with any sort of illness. But that's a thing that doesn't really get talked about ever. So in here, even Dr. Fauci, our favorite media doctor right now, at least for me, was quoted saying that this is shining the light on the disproportionate, how African Americans are suffering disproportionately. So I am just grateful for that. Hopefully something will come out of this that's good, but we don't know. This article also explores other reasons that maybe Black people are more likely to be hospitalized or more likely to get more severe symptoms from coronavirus. And that is they experience more stress just in their everyday lives. They have higher stress levels, which we also know lowers the immune system. And they're just less likely to seek healthcare, and so maybe their symptoms are just getting worse before they're getting help. But they also did a survey asking people if they were very concerned about getting coronavirus. And so 18% of white adults say that they're very concerned that they will get COVID-19 and require hospitalization. However, 43% of Hispanic respondents and 31% of Black adults say they are very concerned about this happening. So we can see that just in the fear of it happening, minorities are much more worried about it severely affecting them and them being hospitalized than white people are. And then it also goes into how black workers are more likely to hold jobs that can't be done from home. They have to go to work in order to make money, and so therefore they are more exposed to this virus just from that. And so, yeah, so just kind of, there's a few things overlapping each other and why we see so much more of this population being hospitalized and getting more sick than others. And that just kind of goes over a few things, and obviously there's always more. But thank you, and I hope everyone's having a good quarantine. And I'll let Fred say goodbye. He's an old man.